Hi there, all my viewers. Dr. Anton here from a lovely sunny day in Pretoria. All right, we're just waiting for a few more people to join us. I see we already have quite a few people that are joining us. All right, but I'm going to get going. I've got so many questions that people have been sending me, so thank you. If you did send a question, I must say, there's such a long list of questions that I'm going to have to nitpick a few, and then we'll leave some time at the end of the session to hopefully have answer a few specific questions on the day. But let me get going. Welcome everybody. I see there's a lot of people that are joining in. Morning everybody. Right, let's get going. So I think the first question that I received from more than one person is, Dr. Anton, can I develop immunity to COVID-19? And the very straightforward, simple answer to that is yes, you can, like with most bacterial and viral illnesses. And people that have attended my seminars and that have been following my website over the years knows that I get excited about certain things, and I want my viewers to get excited about these things as well. I want you to get excited about the immune system, what the human immune system can do. It's a highly sophisticated, complex system, and it identifies viruses and bacteria, and it develops something called memory cells that prevents you from getting an infection again. I think worldwide, there's, one person that they've now found that got a reinfection, because this is the other question that I'm receiving. Can I be reinfected with COVID-19? And there's literally one person on the planet where that has happened. So you'll agree with me that that's an aberrant situation. This is not a normal thing. So your immune system is going to identify this this virus, as many people have. But remember now, and this is now once again the whole concept of statistics. How many people really have COVID-19? This is a question that I am asked all the time. We don't know. If you look at the Diamond Princess cruise ship, half of the people that had it on that cruise ship had nearly no symptoms. And I think there are many people already in South Africa that have developed memory cells and that are through it. They're through this infection, they never had symptoms, and they're doing great. Okay, so that's your answer on can I develop immunity to COVID-19? Can I be reinfected with COVID-19? No, so you're not going to be reinfected with COVID-19 if you had it. The other question that I receive is, will the virus be seen every time this year? The other question that links to this is, will it still be in the air after lockdown? So let me just answer the first one. I think there's a chance that a virus like this can be seen at a different time or different, let's say next year, like many other viruses. They don't just disappear. So there's a chance, but by then, remember now what's going to happen now. A lot of people are getting it, and a lot of people are developing immunity to it. So there's the concept of herd immunity, true herd immunity, which happens in a population where the illness is. So in a way, it's a good thing that a lot of people have the illness, because then the rest of us will get benefit from that weakened virus that has passed through human host. Will it still be in the air after lockdown? I think I love watching movies, by the way, and I've seen all these movies like Outbreak and Contagion and these movies, and we get this concept that they're just in the air and they just hang in the air all the time. And it's really a question here is, okay, let me maybe do it like this. Let me compare COVID-19 to tuberculosis. Tuberculosis is much more infective and hangs in the air, potentially in a room that does not have ventilation for a while. Now, any micro droplet can do that, but from what we know now, and I'll say this a few times in this video today, from what we know now, it would seem that COVID-19 is droplet spread. It's not aerosol spread, okay, from what we know. Okay, so I'm going to say that a few times through the course of this video today is from what we know, because we only know so much. So yeah, that's my question of, will it still be in the air after lockdown? No, it's droplet distribution or droplet spread, and there will still be people that do get COVID for a certain amount of months into the foreseeable future. Then I'm receiving this question. Will some of these questions are really difficult, like this one. Is the lockdown long enough? Has South Africa turned the bend? And I would much rather just give an easier answer and just give you guys the lotto numbers for this week. I'll just put that in the description below the video, because that's going to be easier than to predict exactly what's going to happen in 30 days from now. It's very difficult. I don't know how to answer that question. It looks better at the moment in South Africa. People who watch my videos will see that I did say 4 weeks ago, just remember we're in summer. It does count in our favor. The fact that we're in summer does count in our favor. The fact that there's still a little bit more heat. I know we're in autumn technically, but there's still more heat. We've still got a little bit more humidity, and viruses just don't spread that fast. And if you compare us to other countries, it seems to be a bit slower. The lockdown is definitely going to have an effect. You must remember now that also people constantly compare us to Italy. Italy's got a lot more older people. They have a lot more smokers in that country. They're in the middle of winter. And I'm hoping, and I'm using the word hope because at the end of the day, we're not 100% sure, but I'm hoping that COVID-19 follows the path of its distant cousins. Its cousin SARS in 2003 and its cousin MERS in 2012, coronaviruses. They are RNA viruses. You know what RNA viruses do? They replicate much faster than DNA viruses. And because of this rapid replication, you must remember now, as a virus replicates, it has to duplicate its own RNA sequence to make more of itself. And RNA viruses are notorious for rapid replication and also damaging themselves in the process. So because of the fact that they're RNA viruses, I'm hoping that we will see that it peters out like it did in the past. All right, I see there's a lot of new questions coming in now. And I'm going to try to get to your questions. Let me just, the people have been sending me questions now for the last week, so I'm just going to try to get through as many of them as possible. And I see that there's a delay. I'm sorry about that. I don't know how to fix that. Okay, let me see. Okay, let's go on. This whole video will be available on YouTube afterwards, so you can watch it at your own leisure, and hopefully there won't be such a big delay or problems with the video afterwards. Okay, let's talk about blood pressure medication. So here's the question. I am on an ACE inhibitor. It's a specific type of blood pressure medication. I have read that it could potentially be a problem. Okay, so now we're once again in the world of the new. We've got COVID-19. Is it going to affect me? Possibly is the answer. And you probably should do something just to protect yourself more. And I'm going to tell you what to do. But the issue here is the following, is that COVID-19, this particular virus, likes a particular type of receptor called the ACE2 receptor. Now, the problem with blood pressure medication like ACE inhibitors or ACE blockers is that they upregulate the production, or they upregulate the ACE2 receptor. And that makes it easier for, and this is now in the lungs, lower respiratory tract, and that makes it easier for this virus to bind to this ACE2 receptor and cause more damage. Okay, so you got that. Should you stop your medication? I don't think so, because we're still in the world of the new. We're looking at the theory, we're looking at the chemistry here. I don't think you should just stop your medication, because I mean, that's millions of people in South Africa now suddenly will have to get new medication overnight. But what I think you should do is you need to look at my video on the weaknesses of the COVID virus, because it's in this effect on the ACE2 inhibitor, or the effect on the ACE2 receptor, where melatonin, nitric oxide, and vitamin C has an effect. So please go and look at that video to see exactly what the dose is of vitamin C that you must take every day, and the dose of melatonin, because they definitely will have a protective effect And I'll say something about vitamin C later. It's so important that we talk about vitamin C, but we'll get to that. Okay, so that's the story of ACE inhibitors. Then next question, I am a smoker. Am I more at risk? Now, I think you already know the answer to that question. If you are a smoker, then your risk in general is going to be increased for everything. What else can I say to you? I think you must just go and look at the video on the weaknesses of COVID, because vitamin C is reduced in people that smoke. Nitric oxide is reduced in the lung tissue of people that smoke. So I think someone else also asked me about the whole nitric oxide smoking link. Yes, smoking has an effect on nitric oxide, which is absolutely valuable for a person that is a smoker. So definitely have a look at the supplements. I will end this video with my a few of my top tips, what I'm doing for myself, what I'm doing for my family. My wife's a type 1 diabetic, so I'm treating her with a little bit more care. I've got family members that have asthma. I've got family members that have previous strokes, previous heart surgery. So I'm dealing, and family members on ACE inhibitors. So I'll end this session. I'm looking at those things. Okay, here comes the question. So my daughter has asthma. Is she at much greater risk? Now, the CDC have actually written a formal response about this, where they actually say that they're not sure. They think that during acute illness, and this once again, if you're an older person, that you could potentially have a more severe illness if you have asthma. So my suggestion would be, if you do have asthma, just make sure that you're a controlled asthmatic. Don't wander around the next 4 months having uncontrolled asthma, where you need to use your Astyvent or salbutamol pump too much. Okay, be controlled, and have a look at or listen to my ideas of how you're going to protect yourself even more. But take all your medication as usual. Don't now suddenly start out of fear or out of panic, start just doing different things with your medication. I don't think that's a good idea. That's the answer on asthma. Okay, all right. So a lot of people that have autoimmune diseases and have Hashimoto's have been contacting me about their conditions. And the first question is, I have Hashimoto's. Hashimoto's, for those of you that don't know, is an autoimmune thyroiditis. This is where your white blood cells attack your thyroid. Your thyroid's the gland that sits here, manages metabolism, manages temperature control, so this is what the thyroid does. And Hashimoto's, you've got antibodies that then destroy the thyroid. I had the unfortunate situation where my 5-year-old daughter actually developed autoimmune thyroiditis. So you can actually develop this at any age. It's a bit uncommon for a young child to develop it, but a lot of older people do have Hashimoto's. So the question is, can I use colloidal silver spray with Hashimoto's? Colloidal silver spray is extremely safe, extremely. There's virtually no condition that I know of where you can't use the colloidal silver spray. So you can go ahead and do that. And then the other question is, what about other autoimmune disorders? Now, in my practice, I treat autoimmune disorders. I have a particular passion for autoimmune disorders because my dad had severe rheumatoid arthritis, and I will be making a very specific video about autoimmunity in the near future, hopefully in the next month and a half, which is going to be a much longer video on a different video platform called Vimeo on how you treat autoimmunity. But you should not be concerned about COVID if you have autoimmunity. Having said that, depends on what medication you are on. If you are on severe or strong immunosuppressive medication, my suggestion would be that you chat to your doctor and just check if it is safe for you to continue. Once again, do all the things that I'm going to now just explain to you again at the end of this video. And also just going to have a look at my videos on weaknesses on COVID, the weaknesses that you can exploit, and also preventing viral infections. So particularly if you're using a cortisone treatment. Okay, so here's an interesting one. So there's an article that got published about the BCG vaccine. The BCG vaccine is for tuberculosis, and this caused an absolute furore. People were jumping around saying, must I go and get the BCG vaccine? And let me just be very, very clear about this. This article, it's not even a full research article. It's not peer-reviewed. It's preprint, and I think it caused more of a storm than what it actually should have. And I think early this morning there was even a retraction that was published. So, but it's very interesting. I mean, I actually managed to get hold of one of the most experienced and senior tuberculosis researchers in South Africa last night in preparation for this live session. And he also just told me, he says, they're potentially making too much of it, and also they're doing it too early because they're saying, look at these countries and look at these countries, but we're still technically in the early days of COVID-19 in South Africa. We're in the early days of COVID-19 in many Southern Hemisphere countries, and so we don't exactly understand what they're comparing. But let me say something about this. So they're doing a study now on health workers in Australia where they're now giving them the BCG vaccination, because we know that just after the BCG vaccination, there could potentially be some immune boosting effect on the innate immune system and on lymphocyte. Lymphocytes are types of white blood cells, lymphocyte activation. Okay. It would be a horrible idea to do that in South Africa, because we have too many people that have underlying TB. And if you do the vaccination in them, they get severe reactions. And for those of you that think you've never had TB, you are so lucky to live in South Africa. If you take a proper X-ray of the average South African, you will find something called primary GON foci, or a GON focus in your lungs where you were exposed to TB. But because TB hurts people that are weak. Okay, so 70% of TB cases in South Africa are people that are HIV positive. So if you were exposed to tuberculosis, you effectively were also immunized by the actual disease in the environment. And I discussed my theory with some of the experts, and technically your immune system is primed and triggered by your exposure to actual TB. Okay, so there's effectively potentially a benefit here of living in a country like South Africa where we have a lot of people with tuberculosis, and our immune systems are triggered. So it would be a really bad idea to do the BCG vaccination in a country like South Africa. And we'll see. We'll see what happens in Australia. But I mean, these are the many countries that don't do BCG vaccination. I'm going to end this here now on BCG. Are countries where they've got such low levels of tuberculosis that the side effects of the vaccine became more than what the disease is a problem. And that's why they stopped doing this. But now, let me just say something about and this. I love talking about this particular topic, about the innate immune system. You have to hear me now. The microbiome, and this is one of my fields of research, one of my fields of passion, is the microbiome and the virome. We're still going to get to that. Some really interesting stuff about that. But if you have a healthy biome, okay, you haven't got dysbiosis, you've got the right bacteria in your intestine, where are most of your immune tissues situated? They are in your intestine, okay, 70 to 80%. And that is where these billions and billions of probiotic bacteria are triggering your innate immune system all the time. This shouldn't be a thing that just happens every now and then. This is something that can happen every day because you've got a healthy biome. That's one thing that the BCG vaccine also does, innate immune system. And the second thing is lymphocyte activation when it comes to the BCG vaccine. How do I activate my lymphocytes on a daily basis? I take something called sebitamic acid. And that's just a different word for vitamin C. But I see these days we have to start using fancy words for vitamin C, maybe to give it, more punch, the word. Or another word for it is hexuronic acid. So I just take hexuronic acid every day, and I am getting my lymphocytes and my white blood cells at a completely different level of functioning by taking my hexuronic acid every day. And that's what you should do as well. Okay, all right, let's talk about HIV quickly. Obviously, that is an issue in South Africa. People are asking me about that. I'm just doing a pause here to see some if people are still hearing me. Okay, it looks like you can still all hear me. No comments here that people can't hear me or can't see me. Okay, let's continue. So HIV. Yes, many people in our country have HIV, and we're still not entirely sure exactly how COVID-19 infection is going to play out in people that have HIV. But the one thing that our government has been getting right the last few years is they've been getting people on antiretroviral programs at a rate. And for those of you that read a bit further, antiretrovirals are the drugs that they're now experimenting with in many countries on patients that have COVID-19. So your HIV positive person on medication may actually not be any particular higher risk, but that's all we know at the moment as this whole thing unfolds. Okay, another question, and this is a question that has been, this is like a wave of questions. Can I still take my aspirin and my ibuprofen and my Voltaren and my COX-2 inhibitors, COX-2, cyclooxygenase enzyme 2 inhibitor, non-steroidal anti-inflammatory drugs? So the acronym for non-steroidal anti-inflammatory drugs is NSAIDs. Can I take my NSAIDs? Okay. I think it was the French president or the French minister of health said that they feel that ibuprofen is one of the reasons why people are getting very sick with COVID-19, and he was actually criticized heavily by most countries' health departments, where they say that we don't have enough information at the moment. And that is true. We actually don't know. We're not entirely sure. But let me give you my opinion. I avoid NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs, have a long history of damaging the human body. And any doctor watching this at this moment will agree with me. You have to be careful prescribing an NSAID. You just have to. You haven't got a choice. We've seen kidney damage, heart damage over the long term, obviously, the longer term use, sometimes short term use, days to weeks. But I'm very careful with NSAIDs. And there is early research showing that it could potentially, that COX-2 inhibition, the cyclooxygenase enzyme inhibition, could actually blunt immunoglobulin production or antibody production by B lymphocytes. But there's also studies that then show potential other benefits to the immune system and all that. You know, at the end of the day, I'm very careful of non-steroidal anti-inflammatory drugs, the NSAIDs. If you're on cardiac aspirin for your heart, I suggest that you don't stop. That's now a very low dose. I mean, people that need aspirin for pain, they're going to be taking 500 to 1,000 milligrams of aspirin. Every 4 hours. Your cardiac aspirins are maybe going to be 80 milligrams, maybe 5 milligrams. So don't stop your cardiac aspirin just because you've now heard something somewhere. So that is my opinion on NSAIDs. Then another question here on, this is also a very popular question. Should we now go and find ourselves some hydroxychloroquine or chloroquine? Chloroquine is the old malaria medication. Hydroxychloroquine is the variety that we use in rheumatoid arthritis and other autoimmune conditions. Now, the official stance at the moment is that this is once again purely experimental. A lot of things in the world at the moment with COVID-19 is being done experimentally, except intravenous vitamin C, which is not experimentally. I mean, that intravenous vitamin C has got lovely evidence in very sick patients in ICU, patients with sepsis. So there's very little evidence that supports its use, but people are now using it because they're trying to do whatever to try and help their patients. But there are many studies that have been registered that are now testing, will hydroxychloroquine actually do something? I see in America they're using hydroxychloroquine in combination with azithromycin, which is a type of antibiotic. We just don't know. It's actually, it increases your risk of side effects putting both together. I'm not so sure about the azithromycin. There's just not great evidence for this. Okay, another question here. Should I be wearing a face mask, Dr. Anton? Now, I can't post this video because my daughter will be very angry with me, but she did for her drama project, she did a video on how she's confused that there are so many new ninjas all over the place. I'm referring to all the new ninjas in shopping centers, and I've noticed quite a few myself. So research, all the research looks at this and says, you know what, we can't see a major benefit for people wearing masks during flu season in a country. I mean, there's research that talks it down, then there's research that says, but hang on a minute, you know, maybe it could help. So my stance at the moment is, if you're going to be in prolonged contact, because this is now COVID-19, it's droplet spread, not aerosol, droplet spread in and prolonged contact. If you're going to be in prolonged contact with someone, be kind and wear a mask, because you don't know if you're just pre-infective. And I'm going to get to that question of, am I infective even if I'm asymptomatic? And I see that question's rolling in here at the moment. So this is my when I go shopping, when I'm walking in the aisles in a well-ventilated place, I'm not wearing my mask. But when I get to the till and I have to interact with someone, even if it's 2 meters, I put on a nice cloth mask that I use that works very well. It doesn't irritate my face that much. But I think we're better off erring on the side of caution here. That's my opinion. So if you can, wear a mask if you're going to be in prolonged contact. I mean, obviously, I'm not going to wear a mask in my house. I mean, part of my immunity is to kiss my children. It's part of their immunity as well, is that we love each other in hugs and wrestle and spend physical time together. But with other people, this is my recommendation. I'm chatting to one of South African Airways, one of their pilots. There are teams of SAA now going to Hong Kong and China, and they're starting to fly out now to do cargo flights, but also to repatriate South Africans. So you can watch on Thursday. I'm going to be doing a session there on masks as well, especially in the cockpit. Okay. So yeah, that's my opinion on wearing a mask. I've got one when I go out and when I get close to people. Okay, so now this is now where things get really interesting. I'm going to try to not spend too much time on these questions because I would like to just field some questions from the audience. All right, maybe I'm just going to quickly take this one question. Thanks, Louis, for this one. So colloidal silver, question mark, Mayo Clinic shoots it off. I am shocked. I went and had a look at that Mayo Clinic article, and I'm completely shocked. It seems as if the writer of that Mayo Clinic article never read a single shred of evidence or a single published article on colloidal silver. It is the easiest thing to find published research about. I've been doing research on colloidal silver for the last 18 years. I went as far as taking a sample of colloidal silver to a university engineering department, and we had a look at it under an electron microscope to determine the nanometer size of the particles, which I then confirmed definitely will be filtered by your kidneys, which is different for silver salts, which we've used in medicine for years. We've known for years that silver has got a profoundly antibacterial, antiviral effect. And on surface use, if you spray colloidal silver on a surface, that you kill HIV virus, hepatitis B, herpes, and many more. The adenovirus group, you kill them. And you basically need more than 10 parts per million to do that. So, you know, sometimes it's unfortunate that some of my colleagues sometimes just shoot something off without actually doing a bit of further research. So that's that on colloidal silver. Okay, so now, a question that has been, I've been inundated firstly with videos and voice notes speaking about this whole question of electrical disturbance, Wi-Fi, and things like that. And so the question is, could you share any research with me regarding the theory that viruses are excreted from human cells as a toxic response to electrical disturbance? I've never seen any scientific literature that supports this. Okay, so let me give you some background. One of my fields is the microbiome and the microbiome refers to the bacteria that lives on us and in us, and that we're outnumbered 100 to 1. So the average human being, 37.2 trillion cells, more or less, we're guessing. But that's a good estimate, the newest good estimate. And the bacteria that we have in and on us, maybe 300 trillion. Okay, you are 37 trillion cells, the bacteria in and on you, 300 trillion. So it is something that you must be very excited about, because this is a field of medicine that I've been studying. I have the privilege of training doctors in South Africa with a continued professional development course, a CPD course in the field of the microbiome. And we are seeing doctors that are treating patients with the right bacteria. We are seeing the most amazing effects in people that have chronic illness, from fibromyalgia to Crohn's disease to ulcerative colitis to autoimmune disorders. Okay, that's not this talk now. There's a new field that's being pioneered in Washington at one of the universities there by a professor called Skip Virgin. And Skip has got very, very interesting studies that he's got a big team of researchers that with him, and they're looking at the virome, and they are challenging the concepts that we have. For example, there's good research that shows that certain viruses, when you have the infection, you actually have protection against other infections, and you may even have protection against certain types of cancer. Okay, so you heard me right there, that having a viral infection could protect you against certain types of cancer. For example, people that had the full-blown measles infection when they were kids, they could have protection against certain types of cancer as adults. People that get fever blisters, these annoying fever blisters, you think that you are a weakling and that you suffer. There is now preliminary evidence that you may actually be protected from certain types of cancers, because as a bit of an upside to your suffering. Okay. It's very important, this background, because now another doctor, medical doctor, Dr. Thomas Cohen, has now released a lot of information about his theories. And he's very careful to say it's a theory, that he thinks that viruses, the RNA and DNA viruses with their capsules, are pushed out of the human body because of electrical disturbance. He says it's a theory. Okay. So at this point in time, it lacks evidence, I'll be very honest with you. And I also don't want my viewers to get embroiled and spend endless hours on theories at this point in time. This theory may have something to it later on. But what I want you guys to do is have healthy bodies, practice healthy habits. Because it doesn't matter how this theory changes and evolves, we know one thing, that a healthy human being who drinks enough water, who doesn't eat too much sugar, who exercises, who gets enough sunlight. Sunlight is an immune booster. You need to get outside. I mean, you're at home now. At least go and stand in the sun now that the heavy rain, well, at least in Gauteng. I know in Somerset West apparently it's raining today, but when there's sunny South Africa, or wherever you are in the world, I know it's not just South Africans watching this, get in the sun, but do these things. Keep your body healthy. That we know as much. And I don't want people to get embroiled too much in the issue here of, is it an excretion? What is it? We know viruses exist, and we know that a stronger human being is going to fight it. Okay. So now, this obviously you're now waiting for me to go into the next part, which is, what about 5G? Okay, 5G. I see there's people here that are asking about that. Okay. Right. Should we go and cut down these 5G towers now, like they're doing in some countries? Is EMF, electromagnetic frequencies, EMF radiation, are we sure about what it's doing? There's a book that was written by Furstenberg called The Invisible Rainbow, A History of Electricity and Life, where the book is a call to action. And I did not read this book. I just read a very balanced review that you can go and read as well by Frank Devoit. He's from the Population Health Sciences in Bristol's Medical School. And at this point in time, it's a difficult question to answer because we actually don't have enough research. Okay. And because we don't have enough research doesn't make it right or wrong. Okay. So the research that I'm doing, and I'm looking at this as well, make no mistake, I'm looking at EMF on cell lines. It's called in vitro testing. So what does EMF radiation do to a human cells in a petri dish? And there's effect. It's doing something. And remember now, you get different types of EMF, so we can't just clump them together. I mean, you get EMF from a cell phone tower, then you get EMF from your cell phone that you put next to your head and that you put on your body. So the second type of research that they're doing is they're doing animal studies. And the animal studies, and a lot of these animal studies are looking at the cell phone right next to the animal. And prolonged use of a cell phone next to these animals shows an effect on blood pressure, on glucose, and on white blood cells. Is it conclusive? No, it's not. Does it show us something? Yes, it does. I think this is the most important part. Human studies. And I haven't looked at all the human studies that have been done, but I can tell you now that if you put a cell phone in your top pocket and you let it ring there and let it constantly search for towers, it will affect the electricity of your heart, and this has been studied with ECGs. People have seen this. So, yeah, it's a very, very, very difficult question to answer in full, because we see effect, which in my opinion just means that we should do more research. And I think as a society, we have a right to demand more research, especially now that the towers are getting more, the frequencies are getting higher, so we're going up to 2.4 gigahertz, and so we're definitely seeing an expansion of the EMF cloud that we live in. We need more research, guys. I can't give you an absolute definitive answer, and we as a society should band together and demand more research, that we just make sure that we are safe. But in your home, because I think there's enough evidence that EMF will do something to your body. In your home, don't sleep with a cell phone that's on right next to your head. Put off your Wi-Fi router at night. So that's what I do. In my house, I try to create a EMF dead zone as much as I can. And that's just being careful. I can't actually elaborate too much more on that. Okay, so at the end, I'm going to open up the floor. I'm going to look at the questions that have already been posted here. So then I'll end off just now. We're going to do a few more minutes. So give me a second to just read there. All right, where are we now? Okay. Can asymptomatic people still infect others? You must remember now that for you to infect another person, you have to have a decent viral load. So we've seen that tons of research on HIV, that if you suppress the viral load, that person's not as infective. So yes, potentially you can, but you'll have to be just before the point that you become symptomatic. And your chances, if you're asymptomatic, means there isn't massive viral replication in your body. The moment you have massive viral replication or duplication of viruses in your body, you will have something called seroconversion illness. You will get sick. You will feel fever. You'll feel it. If you haven't got no symptoms, then the risk to infect someone else is much lower. But with prolonged contact, yeah, it's technically it's a possibility. No, this is not right. So there's a theory out there. Someone's asking here. I think it's Sean from Archery Corner. There's a theory there that healthy people are going to get you're going to get even more sick, because now you've got healthy white blood cells and they're going to make your cytokine storm more. No, that's not true. Healthy immune system, strong. You're gonna do better. It's a virus after all. Right, and we've spoken about that. Okay, so I think I've answered most of the questions. Also, that I see a lot of the questions that are being asked now, I've covered. So let me just tell you, to just reiterate a few things and just to maybe conclude now, is we should be careful to grasp at straws. And I'm speaking to my medical colleagues as well, because I'm hearing now there's an old head lice treatment that guys are experimentally looking at as well. How about we just focus on the things that have evidence? And this is where the whole vitamin C discussion comes in, and where I jokingly refer to vitamin C as hexuronic acid or sevotamic acid, because maybe that's what we need to do. Give it another name, make it more of a punchy name. Hexuronic acid. That's what I use for COVID. Oh wow, what is that? And the point is just hexuronic acid, vitamin C, is going to interrupt the whole secretion of zones by COVID-19. It's going to interrupt the whole cytokine storm. That's why some doctors, not many, sadly, But some doctors have realized that now, and for their ICU patients, they're giving them 1.5 to 3 grams of intravenous vitamin C every 6 hours, which is what you should be doing, friends. We've got enough evidence. This is evidence-based. Hydroxychloroquine, chloroquine, azithromycin, most of the antiretrovirals, the head lice treatment, these things just don't have evidence to them. So let's start with the things that we know will work. Then I spoke about probiotic bacteria. Make sure that you're taking a good probiotic. Sadly, I can't endorse products on this channel, but phone the people that on the bottle. Look at them, phone them, ask them that they do decay testing, that they, how do they make it? Should it be on the shelf? Should it be in the fridge? Things like that. And I will be releasing microbiome videos soon. Fulvic acid. I spoke about this in my preventing viral illness video. Fulvic acid is a very good immune modulator. It's very good for autoimmune disease as well over the long term. Take a fulvic acid supplement. It's going to be good for you. Use your colloidal spray, more than 10 parts per million strength. Drink enough water. Make sure that you hydrate it. Hydrated mucous membranes do so much better with viral infections. And if you do have a mask, when you're close to other people, put your mask on. You know, it's preventative. We should actually learn from all of this. And maybe that's my concluding statement that I want to make. Let's learn from this COVID-19 crisis how to behave in winter. Many times in winter, I think for many of my doctor colleagues, I actually don't want to shake people's hand. I would have liked them to wear a mask, especially if they've got a cold and they've got an active infection, because that's where a mask works the best, is when you have an active infection. Then you are going to prevent, or you're going to at least prevent to an extent, your infection going to other people. I think that's a very kind thing to do, is to wear a mask if you are sick. So I'm just going to quickly have a look at last few questions. Then I would really like to invite you guys to join me on Thursday. I am chatting to one of the pilots that's in a cabin crew of about 15 people. They're getting ready, preparing themselves to do these flights into China. You know, we call them frontline workers. So I'm going to be chatting to Alex McPhail from SAA, and we're going to have a chat about my top tips for protecting them on the front line. You've heard of some of them today, so there's going to be some good repetition there, help you to remember it. So that is about all that I have time for. I really hope you guys enjoyed this, and I'll try to do it again. I've got a little bit of limited time. Some of us are dealing with a lot of literature at the moment during this lockdown, so I'm actually quite busy, but I'll try to do this again. I am going to be releasing videos as well in this time. I've got a series called Dr. Anton's Rockstar Nutrients. So there's one coming up where I'm going to elaborate. The next one that I'm going to do about that is going to be about hexuronic acid or sevotamic acid. That's going to be my next Rockstar video, where you can learn about vitamin C, hexuronic acid. So guys, thanks for joining me. I see I had a very nice audience that joined me today, and yeah, we'll do this again. Thank you very much for being here.